I'm gonna put them on the website for all the people who can make it to the talks. So, but they couldn't participate in the discussions, right? So, well, hello everybody, and thank you so much for coming. Thank you for coming, those who come almost every time, right? So thank you for participation and dedication, and thank you for new people for coming today. Thank you. So usually I start by telling a little bit about myself and about naturopathic medicine. So my name is Dr. Masha, and I'm a naturopathic doctor licensed in the state of California. So naturopaths are primary care physicians or doctors that can order advanced labs to heal the acute conditions, to deal with chronic conditions. Actually, some of the chronic conditions can be reversible with natural medicine, and also we can prevent the conditions, right? We can prevent a lot of diseases. So that's what we do. I have some brochures if you want to take them. I'll just pass them around. You can read a little bit. I'll just leave one for myself. We can read a little bit about naturopathic medicine here. They're very well done. So what naturopaths do, what we use. So we do believe that the health could be restored. It could become to balance. Hi, Dan, how you doing? Good. Thank you for coming. So, and yes, here's what we use, the dietary recommendations, counseling. We do believe in that the body sometimes needs the time to detox. So we do specific combinations with vitamins and minerals depending on the nutrient deficiencies. Like I was telling earlier, we do use IV therapy too, like B12 shots or maybe high dose vitamin C. So we do use bioidentical hormones, and we also cooperate with other practitioners, right? We cooperate with wellness coaches, we cooperate with chiropractors, acupuncturists. So we like to work in unity, right? Because if we all work together, then the patient always benefits. So, and also on the handout, today I decided to do handouts and no PowerPoints, trying something new. Sure. So I also listed the conditions that naturopaths have really high success rates. And this is not a limited list of conditions. So just to give you a ballpark, the common conditions. So, and I have my phone number there and email if you want to let me know if you have any questions. All right, well, today we're going to talk about mindfulness, which is probably the hardest thing, right? So it's sometimes so much easier to change the diet for some of us. Maybe take herbs and supplements, go for a run and exercise. Sometimes we think, oh, just better go for a run than sit down and not think about anything for 30 minutes. It seems to be a big challenge, not think about stuff, right? So it's hard. We all struggle with that. For me, it is the struggling thing. It's really hard for me to sit down for a number of minutes, or even like 5-10 minutes, and just be in the present and not think about this or that. So I'm working on it myself. So yes, to confess. But let's talk about it together. Maybe you have some good suggestions. Maybe there is something that you do that could be helpful for all of us. We'll also look at, as we always do, at the research. What research shows, how is meditation helpful, what it does to the body physically and mentally. So yeah, let's delve in. So mindfulness is a type of a meditation practice that cultivates present moment awareness. So like I said, we're not thinking about anything in the future, what we're gonna cook tonight, right, or tomorrow. We're not thinking about the past. We just staying put in this moment. Right? We're not maybe experiencing all this bound of emotions. It's just kind of trying to come down, right? That a quote that I used by Viktor Frankl, that between the stimulus and the response that we're going to have, right? Like if somebody told us, oh, we want a lottery, right? So in between how we're going to react, there is a little space, right? So that space, right, allows us to react or to think or to take a breath. So it's important, as we will see. With meditation, it doesn't require any religious background and doesn't require any denomination. Anybody can do meditation, and there are so many different forms of meditation. There is no right or wrong way of doing it. It's just whatever fits you. The same with exercise, right? So many different types of exercise. So, and then the goal of meditation is to, I'm just going to pick it up and read it, to maintain awareness moment by moment, disengaging oneself from strong attachment to beliefs, thoughts, emotions, thereby developing a greater sense of emotional balance and well-being. So basically, yes, it's not experiencing a lot of strong emotions. Just sitting, breathing in the moment, not trying to analyze things, or maybe listening to the sound, listening to your breath, have some kind of image, one particular image going on. So whatever works for a person, but it's just disengaging from everything, just making your mind not think about anything, right? Though we think, oh yeah, we do it at sleep, right? When you go to bed, you sleep and the brain works, or the brain rests. Well, it turns out, according to our sleep talk, right, when we talked about sleep, we don't really rest the brain doesn't really rest at night that much, because it's consolidating the memory. It puts all what happened during the day in little spots. So it's really working a lot. Actually, it's maybe sometimes works more than in daytime, right? So we cannot consider sleep as a complete rest for brain, though it probably rests some. So we do need to do something during the day to take care of that. And what are the benefits of the mindfulness? So you can read through it, and I'll just highlight a few of them. So it's a decreased perception of pain severity, especially it's a good thing for people with chronic pain. If they tried everything out there, if they tried medications, natural therapies, acupuncture, sometimes seems like nothing really helps. And what could be the answer? Maybe they could try the mindfulness techniques. And as we see, I will show you one research where it could really help people with chronic pain. So this perception of pain in general is a really interesting subject, how our body remembers, though the stimuli is already gone, but the body still remembers that area needs to be firing, right? And it still sends the signal, but though it shouldn't be painful anymore, right? So it's kind of interesting. So maybe through the mindfulness, we help ourselves. Increase ability to tolerate pain or disability, reduce stress, anxiety, depression, works great for anxiety and depression. So we can have increased motivation to change something in our lifestyle, or improved adherence to medical treatments, and lots of other ones. You can actually look through. There are 9 that pointed out. So, and like with everything else, there's more and more research coming out. It is a little bit tougher to do research on meditation because there are so many factors, right? With nutrition, you can measure the nutritional amounts, maybe. With exercise, you can measure the muscle mass, right? You can measure some other aspects. With the mindfulness, there are just so much, right? It affects our whole psyche. But they still do it, and they still do it. Actually, we'll see that you can actually do it on immune cells and see how many immune cells before you did meditation and after you did meditation, how it affects so many systems in the body. So this is a study, as an example, that was done in 80s, long time ago. They took patients, 58 participants. Some of them had chronic pain 6 months, some of them had chronic pain up to 48 years, so maybe majority of their life. So in this study, doing the mindfulness techniques, stress reduction, And they noticed that after a certain amount of time, actually, I didn't point out the amount of time here. Should have probably looked at the research paper a little bit more. The 51 out of 58 participants, so 88% of people, said that their pain decreased by 50%. That's really great results. You know, sometimes it's hard to achieve that with other things we use, right? With herbs, sometimes it's hard to achieve. So yeah, this is one of the studies. Then there are a lot of studies that show, the study that I remember from medical school, the students who did the meditation at school, it was kind of part of their lifestyle. They measured their immune cells, and they had a much better response and a lot more immune cells than students who didn't do any meditation on a daily basis. And then the study here with cancer patients, actually very interesting. They took 109 people, and they also saw they were from ages 27 to 75, and they did mindfulness techniques there with some of them, and some randomly didn't, like it was randomized study, right? So, and it showed that it decreased their mood disturbances by 65%, and that they overall they felt a lot better in 31% of cases. So it was really helpful that to do the meditation with cancer patients. So I remember interviewing a cancer patient when we were doing documentary with my friend about non-toxic cancer treatments. He did a whole program, alternative medicine to heal from cancer, and it was really helpful. So, but one thing, when we asked him what was the most helpful one for you, he said that meditation. So though he was an engineer, he was working a stressful job for 30 years. Once he found out, he started changing a lot of things, and one of the changes he did, he would meditate for 30 minutes every day in the morning. For I think 4 years that he was doing it. He's still doing it. I think it's just his daily life now. So, but he said that that was really helpful to him, and it was just 30 minutes a day, right? So it doesn't take that much time. So we can't really say, oh yeah, I don't have time for meditation, because it could take 5 minutes, 1 minute. So we'll talk about how to do it a little bit. So one of the techniques you can use when you're in a stressful situation, if something comes up and you want to react to it, you can, how it is over here on this handout, stop, take a breath, and then observe the situation, and then proceed. So that taking a breath is actually kind of a little pause that allows you to maybe react in a like milder way, right? Especially when we're angry, or we want to, say like somebody sends you a bill that you're actually not supposed to pay, right? That makes us all really angry. Calm down. What are you thinking? So, but maybe just taking a breath would help, right? Not to have these extreme emotions. So in talking about emotions and how they affect our organs, last week I went to a talk of this one physician who was talking about how our emotions affect different organs. And in Chinese medicine, it's already known for a long time, but now the science actually is catching up, and different types of scans are showing when the person, for example, had a lot of anger throughout life, suppressed anger, right? It wasn't released, right? It was just kind of stored, and it tends to store in the liver, right? And then the person tends to have more liver issues, right? So, or people who have a lot of grief, who went through a lot of grieving, a lot of strong emotions in this regard, they tend to have more like long heart problems, right? Like heartbroken. Sometimes it literally, the heart is not functioning well because of the heartbrokenness. So yeah, it seems like our body, our physical body, reacts to the things that happen emotionally. So yeah, we kind of have to be mindful of that. Sometimes it's hard to determine it yourself, maybe talking to somebody, talking to practitioners, to somebody you know, helps to recognize that pattern that you have, that emotion that you try to follow. So yeah, one thing that you can do to kind of an easy type of meditation, because it's kind of visualization with the meditation, we can all close our eyes and just imagine that underneath our belly there is a vase, and you can color it any color you want. It could be pink, yellow, clear, whatever you want. And then every time you breathe or take a breath, it fills up with water. And every time you breathe out, the water goes down. So it happens every time you breathe and breathe out. So this concentration on that one vase that is inside and the water going in and out, which kind of takes your mind off the situation that is happening, and you are able to take a break, especially if like something stressful happened. So we can do it for a few minutes. Let's do it 10 times. We want to come back. So wonderful. How did it go? Pretty good, right? Kind of feels like, oh, we renewed ourselves. Though it was just such a simple thing to do, right? So yeah, you can do this, and there are so many other ways, right? This is just one of the techniques you can use. So that kind of introduces us into breathing, right? That we forget to breathe. We actually don't need to think about breathing. Our body does it for us, luckily. So, but then we tend to breathe shallowly, right? The shallow breaths. We just, right? It's just, sometimes it's hard to even catch a breath because there's so much going on in the mind, so much going on in life, that the breathing doesn't become a quality breathing, right? So it's good to stop and breathe too. And that's not that hard to do because you can do it while driving, right? You can just do this breathing or the vase technique. Or you can do it while washing dishes, cooking, taking a slow walk, right? There are so many opportunities during the day, and there is no excuse not to kind of concentrate on the breathing. And there are different types of breathing, and it's a whole big science. There are so many schools of thought. There is Buteyko's method, where actually you're not supposed to exhale too much. You conserve kind of some of the carbon dioxide. So there is deep breathing. There are some techniques where they actually breathe out a lot. So there are so many different ways, and they contradict each other all the time, as it is in medicine and science, right? So, but it doesn't matter. And for us, for general population, it doesn't really matter because we're not talking about something very precise. We just talking about in general that it's good to stop and take a moment to pay attention to what's going on with your lungs, to hear your breathing, to kind of concentrate on it. That's the whole point, right? The way how you do it, you can do it many different ways. And so I listed one of the study for multiple sclerosis patients when they were doing some breathing techniques as a home exercise. So their lung capacity increased, and they in general were feeling better. And there are more studies too. So So yeah, and there are two breathing exercises that are listed here. There is the equal breathing technique that they usually use maybe during yoga. So you inhale for the same amount of time and you exhale for the same amount of time. So if you inhale for and on the count of 4, 1, 2, 3, 4, and then you exhale 1, 2, 3, 4, and you kind of do it. It doesn't have to be too fast, right? We don't want to get back to the shallow, fast breathing because that's not great. And it's not great because the air that we breathe contains oxygen. So the oxygen oxygenates our lungs, and then it goes into all our tissues, and we use it for energy. Cells prefer using oxygen. We want to have a lot of oxygen in our body. So the deep breathing or the paying attention to the breath brings more oxygen than the shallow breathing, right? So probably the best breathing, probably a lot of people would agree to this, is the abdominal breathing, right? Because sometimes whenever you ask somebody to breathe, right, they're breathing like this, right, using their shoulders. We always say they use their accessory muscles. The only muscle that really should be working when you breathe is the diaphragm. Right, it's the internal muscle that expands the lung and contracts the lung, expands the lung and contracts. So we shouldn't be using our chest muscles, right? We have some pec muscles here. Shouldn't be using them, right? We should be mostly using this internal muscle. So it kind of feels like we are breathing with our bellies. So we can even try to do this exercise, the abdominal breathing. So you can put one hand on your chest and one hand on your belly, and take a breath through the nose, and try to just think about that muscle internally. Maybe you saw it on the picture, maybe I can even find it. It surrounds the lung, so that muscle will move, expands and contracts. So we can do, the goal is 6 to 10 deep breaths, that's according to this particular article, but you can do as many as you want to. So, but the good thing is the consistency. Consistency. What a good group, right? Excellent, wonderful. So yeah, and I just wanted at the end to add that there are lots of meditation places, right? And you probably know a lot more. I just listed some that I googled here in Long Beach. There are lots of apps, right? You can download an app on the phone. Some people prefer meditating in the morning. Some people prefer meditating or going to bed, especially if there are sleep problems. It's a good idea to take some deep breaths, which is kind of half a meditation. You know, if you can just think about how to meditate, you can just take deep breaths, and that would be your meditation. So before going to bed, kind of like calm your mind, because sometimes it's hard to fall asleep for people because the mind is still so busy. So, but once you're trying to calm the body, the mind can actually come down too. So yeah, you can use YouTube videos. There are lots, right? So we have lots of resources to use. Here we have a Sunday sit with Casey. So it's excellent. I went there, and it's great. A lot people come together, meditate, and they actually do a lot of activities together too. So they also do self-care private sessions here where you can do lots of other things and meditate. So there are lots of opportunities for people to meditate, or just at home at your own time, whenever you feel comfortable meditating. So yeah, so this is my talk for today. If you have any questions, you can surely ask them, or we can open it for discussion and just talk about meditation, what everybody does, or maybe some other techniques you can teach us. So if anybody wants to talk.
I know that when I meditate, I like to use a certain type of essential oil. It gives me a high frequency, so I use the sacred frankincense.
The sacred frankincense.
It's intended to give you a spiritual, vibration that helps you meditate.
Oh, that's excellent. So you put it just a little bit, right? Kind of like a couple of drops. Oh, you inhale it, and then you just helps you meditate. That's awesome. So it's sacred frankincense.
Yeah.
And is it only in Living Young, or the same one could be in other companies too?
It's my understanding that they're the only company that has the sacred frankincense because it is from a different frankincense tree.
Oh, gotcha. Different frankincense tree.
Yeah.
So looking for that particular one. Sacred frankincense. Well, that's good. Do you do any kind of particular meditation? What do you think about, or do you concentrate on an image, or how do you do it?
When I was trained 25 years ago, I was set to do a 20-minute
20-minute
meditation, and then I recently took an introduction to transcendental meditation. But that was just an introduction. Apparently, it's more detailed.
Right.
And expensive.
Right.
Process.
Right.
So that's later.
Right.
I don't know. I'm curious. Does anybody do transcendental meditation? No.
What is that?
It's apparently a very detailed explanation of how to meditate, and it's supposed to feel amazing. A lot of famous people are very involved in it. Ellen DeGeneres and Oprah. So there's a person here in Long Beach that offers a free introduction, and then there's a fee depending on student or child or adult, ranging from like $300 to $900 for this series, and it's supposed to be just pretty amazing.
Right.
Exercising your brain and having that peace and happiness.
Right. Yeah. That could be one way, right, of doing it. Yeah. Wonderful. Anybody else?
Well, I'm running on the treadmill.
Oh, good.
Yeah.
So you exercise and you kind of meditate too.
Yeah, because you have to focus on your breathing,
Right.
and it's boring, so you're thinking of certain things, maybe positive.
Right.
Maybe what you need to do, or
Right.
but you get ideas, and you're running, so you get the endorphins going.
Right. Good.
Beautiful.
Yeah. Excellent. Good. Yeah. That's when they're exercising, and then you're kind of trying to
You go in the zone.
Right, you're in the zone, right. It's definitely great for exercise too, right? Then you're not distracted, right? You're just like, you're doing what you're supposed to do
So
for
you
some time.
try to get in that zone, and you're channeling, and you're feeling good. You don't even feel like you're exercising. You're
Right.
feeling like you're floating sometimes.
Oh, that's great. So it's kind of like meditation / exercise, right? That's great. Yeah, that's what Qigong is. I did some Qigong when I was in naturopathic school. So it's kind of like, the Qigong, right? The movement, different poses, the same with Tai Chi. So it's basically the meditation and movement, right? You're still really concentrating on the move. You're thinking about it, but then at the same time, you're not thinking about anything else, right? You just, it's like your whole body is just like this hand should be going this way, this hand should be going that way, right? So it is kind of like a meditation and a movement at the same time. So yeah, combination of both.
Where the exercise becomes second nature.
Right.
You're just like, you feel like it's out of body experience. You're just thinking other things, maybe creativity.
Right. Allows you to be more creative. Good. Excellent. Thank you for sharing. Anybody else?
I use a couple different apps.
Uh-huh.
I've always struggled with meditating.
Right.
So I use a couple different apps to help me because they guide you along. So I use Headspace, Insight Timer, and Stop, Think, Breathe.
Stop and breathe.
So I think they all offer something different. So whatever you connect with the most, those been helpful for me.
And how long do you do it? Do you do it daily or?
I've been trying to do it daily.
Oh, right.
However,
It's a challenge, right?
Yeah, sometimes it ends up being every other day.
Right. Do you do it for like 5 minutes or 30 minutes?
I try to just listen to my body and what I'm feeling like that day. Some days I'll do a longer one and I'll sit in it for 30 minutes, 20 minutes. And then other days I just need like 5 minutes.
Right, to recoup.
Yeah, so just depending on how I'm feeling that day.
Excellent. Yeah, good. I listed some of the apps too.
Yeah.
But those, it's good to know that you use those. So it's good to know that take a breath, right? And then Headspace.
Yeah, I had two other thoughts. I recently took a tea class, and I was told that the concept of why the cup is so delicate and you put your finger, it's supposed to be a meditative process.
Oh, I got you.
So just any time when you're able to be more centered in the moment, like exercising,
Right.
or rock climb. So this idea of just being really aware and present is just, I think, the concept that we want to get to.
Right, exactly, in meditation.
And then secondly, so understanding that when we take a breath and inhale, that's stimulating our, when we exhale, it's the parasympathetic nervous system.
Right.
When we inhale, it's more the fight or flight nervous system.
The sympathetic.
So the idea of simply doing a longer exhale allows our body to exercise that nervous system part that we don't get to stimulate as much.
Right.
So that single act of doing a longer exhale instead of just thinking about breathing in.
Right.
Is actually the better half of the breath. Yeah.
The longer exhale. Just for stimulation of the parasympathetic system.
Yeah.
Excellent. So that's good.
Yeah.
Good. Learning so much. Anybody else? Anybody else like to share? Did you guys try to meditate or?
I use one of the apps that she uses. It's
Uh-huh.
the Think Breathe one. That's really helpful in moments that are really intense. But as far as incorporating it into my daily life, that's gonna take practice.
Right.
Yeah.
Right. Exactly. It is challenging. It's so funny how this simple thing, just sit and think about nothing, is more challenging than anything else. Like we are ready to take herbs, supplements, spend money on them, go for